You notice shortness of breath and a stark pain in your chest. You might have lost your taste and smell, and you're breathing like you just walked up 3 flights of stairs. These symptoms signal a trip to the emergency department of your local hospital. How will you be treated? When would you be put on a ventilator? And how could you develop a severe case of COVID-19 despite being perfectly healthy? Before you rush in, call your doctor or hospital ahead of time and describe your symptoms. You'll want to do this because your local emergency clinic might not have enough beds and may need to direct you to another facility. Or your symptoms might not be considered severe enough yet to require treatment at the hospital, so it's best to check by phone first. But once you are admitted, nurses will give you a COVID-19 test. Most patients will also have a set of blood tests taken from their veins. Doctors will then listen to your lungs and check the levels of oxygen in your blood with a clip-on finger monitor. Why are they doing that? Because if you have severe COVID-19 symptoms, the oxygen levels in your blood can drop too low. Since this can result in life-threatening damage to your vital organs, you'll get oxygen to breathe through 2 small tubes that go just inside your nostrils or through a face mask. You'll then get a chest X-ray or a CT scan so that doctors can get a better understanding of which areas of your lungs are inflamed. A CT scan, also known as a computerized axial tomography, is a painless diagnostic test that uses X-rays and computers to create cross-sectional images of your body. A CT scanner is a large square or round X-ray machine with a tunnel through the center. It helps doctors see into your lungs. During your CT scan, you will lie on a table that slowly passes through the tunnel. A giant ring called a gantry will rotate around your body. It contains a tube that releases X-ray beams and detectors that will measure the amount of radiation absorbed by your body. And these beams will capture many views of your body from different angles. As the gantry spins, the detectors will send data to a computer that creates cross-sectional images or 3D models of your lungs, helping doctors diagnose the severity of your coronavirus infection. Once your doctors have all the data to determine the progress of your COVID-19 infection, what treatments can improve your condition? Well, some patients may get standard antibiotics. These won't fight the coronavirus directly, but could be beneficial if you develop an additional bacterial infection in your lungs. But because there is no approved medicine specifically for COVID-19, you'll be relying on your immune system to fight off the virus and hope that oxygen therapy combined with supportive care can help your body recover. If things go your way, your immune system will start to produce antibodies to slowly kill the virus. But what happens if your condition worsens? If the oxygen concentration in your blood then drops below critical levels, doctors can escalate your treatment to something called high-flow nasal oxygen, which means that a machine will be pushing air into your nose, warmed to body temperature and humidified with sterile fluid. You can get up to 60 liters of oxygen per minute and up to 100% concentration. If high-flow nasal oxygen is not an option or didn't help, doctors will start you on mechanical ventilation in a last life-saving effort. You will be given medication via IV to put you to sleep. The first step in mechanical ventilation is called endotracheal intubation. Once you're asleep, your doctor will use an instrument called a laryngoscope. This device helps guide the endotracheal tube to its proper position. Your doctor will tilt your head back slightly and insert the laryngoscope through.
لا تنسوا الاعجاب بالفيديو والاشتراك في القناة.